Hi, let's talk about serrapeptase. What is it? There are some enzymes called proteolytic enzymes. Now, there's so much talk these days about enzymes as supplements. So let's be clear. One kind of enzyme is used to take with food, and that helps to digest your food. Then there's a different class of enzymes that you take away from food on an empty stomach that go to work at some target tissues in the body. One of those proteolytic enzymes is called serrapeptase. Serrapeptase is the enzyme that silkworms actually excrete to digest their cocoon when they're ready to come out. And we don't understand the exact mechanism, but when it goes to work in the body, it eats up things that aren't so helpful there. So there's a couple areas that there's really good research. And when I'm talking about good research, I'm not talking about somebody's opinion. I'm talking about when you get on the National Institute of Health's database and you look up serrapeptase, there are some clinical research studies that have shown it's been effective. One of the big things we hear about is biofilm. So when people have waste products or in their body, or say they are trying to fight an infection like latent strep in their body, or if somebody is having a buildup of yeast and toxins, or for example on breast implants, one of the reasons sometimes they get rejected is because the body forms a biofilm. There are so many studies that talk about serrapeptase's efficacy for biofilm reduction. Another thing that we're seeing some recent studies about is its effect for post-COVID syndrome. There are a number of studies about serrapeptase for not breaking up, but helping dissolve clogged ducts in nursing mothers. One of the other things we see is sometimes when people get a surgery for sinuses to unblock, if you will, a clogged sinus, there is a problem sometimes afterward where there's a lot of swelling in the buccal glands. And so with that surgery, they find that serrapeptase is helpful for decreasing the amount of post-surgical swelling. And they start giving it to people as early as day 1 and have them take it for 7 days out in most of the research studies that are out there. Another thing that serrapeptase is touted for is helping with chronically clogged sinuses, and a little bit for different proteolytic enzymes have been shown to be helpful for plaques in the arteries. And also after molar extraction, there's a lot of research study that helps with that. I have found time and time again with my patients who have endometriosis, when they are on serrapeptase, I can very much palpate the difference in their tissues. I don't have a research study to show you, and I've combed through the research looking for something with abdominal adhesions or even endometriosis, and I'm going to be honest, there isn't anything I've found yet. But the other thing is that serrapeptase is really being hailed for its anti-inflammatory properties. And we know that with endometriosis, one problem is adhesion formation. Another problem that we have with endometriosis is prostaglandins. So the tissue itself that is acting in an endometrial manner increases the prostaglandins and the inflammatory mediators around it. And then that has been shown in some cases to convert cells into more endometriosis-like cells. So we don't know the exact mechanism, but I will say that for any of the patients who are coming to see me for long-term endometriosis care, I am not a doctor, I'm not even playing one on YouTube, but I will have them talk to their provider. I live in a state where there's a lot of naturopaths, so there are many people who are medical providers who are very familiar with what the mechanism of action is. And I like them to talk to somebody about that to make sure it doesn't interfere with any of their meds, because that is not my specialty. I'll leave a different video about how patients with endometriosis might use it, but serrapeptase is spelled, well, you can see the link below. And I'll make a different video about how patients with endo may use serrapeptase. Thanks.